Welcome to the Bassline. I'm Jeremiah Hosea. Dr. Kimberly Biss is a dedicated and experienced obstetrician gynecologist practicing in Florida. In a matter of weeks, we will be recording an interview for my medical freedom dedicated radio show, The Bassline. In the meantime, Dr. Biss has kindly agreed to participate in a written interview, which we have voice-generated here to make it more convenient to receive the information. In her medical practice, she has observed a variety of disturbing trends since the rollout of the gene-based experimental COVID injections, which were first made available to the American public on December 11th of 2020. Dr. Biss, thank you so much for taking the time to participate in this interview. I would like to ask you, first of all, what abnormalities and disturbing trends have you noticed since the rollout of the COVID injections? In the 3+ years they have been available, what has been the arc of the problems you have witnessed? Was there a peak, or do you find these problems to be ongoing?
I sent data I collected from January 2020 until November 2022 to Jessica Rose, PhD. The data shows the miscarriage rate going up 100% year to year. 2020 was a normal year, with a normal 4% miscarriage rate, normal new pregnant patient registration numbers, and normal deliveries. In 2021, there was a 7 to 8% miscarriage rate, along with a decrease in newly registering pregnant patients, suggesting infertility or pregnancy losses. In 2022, the miscarriage rate increased to 15%. In December of 2022, the miscarriage rate was 27%. In January and February of 2023, the miscarriage rate increased to 30%. The rate did not return to normal until June of 2023. 65% of our obstetric patients had been vaccinated. Most had 2 to 3 injections in 2021 and early 2022. Very few had 4 or more. The fact that miscarriages continued to increase in 2022 and 2023 is concerning, as these events were remote from the time of injection. We also saw increases in the following: preeclampsia, meaning high blood pressure in pregnancy; oligohydramnios, meaning low amniotic fluid around the baby; postpartum hemorrhages, defined as loss of 4 or more units of blood after delivery. In our gynecology population, abnormal menstrual periods increased. Post-menopausal women also began bleeding. Both situations resulted in surgeries, and some patients underwent hysterectomies. Abnormal pap smear rates increased by 15%. Breast cancers increased as well.
What has your communication been like with other doctors in your field regarding what you are describing? Are other obstetricians and gynecologists noticing the same things? Are there any institutions acknowledging the negative trends you are observing?
There are approximately 62,000 OBGYNs in our country. There are fewer than 10 of us vocalizing these concerns. In September of 2021, our board, the American Board of Obstetrics and Gynecology, sent an email telling us to play nice in the sandbox, or we could lose our board certification. This is not the same as losing a medical license. However, most hospitals and insurance companies require doctors to be board certified.
How has the past 4 years changed your personal views in regard to doctors and the medical profession as a whole? This is a huge question, I know, but what are your key takeaways?
I began questioning Big Pharma and Big Food when I began eating the ketogenic way back in 2018. I listened to a lot of podcasts and learned how many lies we had been told regarding fat. This made it easy for me to be suspicious of the recommendations we were given early on regarding COVID. Nothing made sense to me. Lockdowns, the 6-foot rule, masks, stopping elective surgical procedures, and no outpatient treatment for respiratory infections. The coercive tactics used to encourage vaccination using a brand new genetic therapy sent me down many rabbit holes. I no longer support any vaccines. None have been developed and tested against a true placebo. Turtles All the Way Down is a great book that discusses this. There was a lot of groupthink and intellectual laziness over the past 4 years. In the early 1990s, when I began medical school, the concept of evidence-based medicine emerged. This meant that someone decided what the evidence was, most likely Big Pharma, and treatment protocols were put into print as recipes or algorithms. If a physician did not follow the recipe, they would have to explain themselves at peer review, or worse, to the state medical board. We saw this during COVID, with physicians losing their licenses for prescribing ivermectin. This approach eliminated the practice of individualized medicine and discouraged physicians from thinking or asking questions. The FDA, CDC, HHS, our medical colleges, and our boards are all bought and paid for by Big Pharma. Medical schools receive significant funding from pharmaceutical companies to promote a problem equals pill or injection model. There is no emphasis on diet, exercise, sleep, or supplements. Our literature and research are captured as well. We have sick care, not health care. The United States spends the most on health care in the world, yet ranks 79th in outcomes, lower than Cuba. We consume more than 50% of all pharmaceuticals, while representing only 4% of the global population. If I were younger, I would train in functional medicine. They are the real deal.
To what extent have you been successful in treating the vaccine injured? While everyone's medical history and circumstances are different, have there been any breakthroughs, or at least positive developments, in treatment?
I am very involved with vaccine-injured groups and contribute where I can. Patients experiencing infertility are referred to reproductive endocrinologists for evaluation and treatment. For abnormal bleeding, I conduct the same traditional workups we used prior to these injections. I have not prescribed ivermectin or NAC. Conventional methods and surgical procedures remain the primary treatments. I am waiting for more research before exploring alternative therapies. I am involved in a research group actively working to find answers. At this time, I am not recommending supplements or red light therapy. My contribution also includes advocacy, informing patients of the dangers of the injections. Many patients do not know, or have not been told, that their symptoms may be related to the shots. I tell them no more injections. I do podcasts, interviews, and have testified before Congress to help get the word out.
In your estimation, what should the medical freedom movement prioritize in terms of short-term goals?
Stop the injections immediately. Stop all injections that use the mRNA platform. Reverse the law that allows pharmaceutical companies to advertise directly to consumers. Only the United States and New Zealand allow this. Exit the World Health Organization and end support of the United Nations.
Thank you for your courage, and thank you for being generous with your time and wisdom, Dr. Biss. Warmest regards to you and your family. Additional resources and informative links provided directly by Dr. Biss are included in the description.